Good afternoon and good morning to you if you are on the West Coast. My name is Jose Leon, Chief Medical Officer for the National Center for Health and Public Housing. Thank you so much for participating on today's webinar, the role of CHWs on teen pregnancy prevention and HPV vaccine promotion in Hispanic adolescent girls living in public housing. We are very happy to host this third session. And we are very happy to have a public housing primary care grantee participating and sharing some of the best practices and evidence-based programs that they have in place. So next slide, please. The National Center for Health and Public Housing is supported by HRSA to provide training and technical assistance to community health centers across the nation, specifically those located in or immediately accessible to public housing. Next slide, please. This is a live activity. All lines are muted. If you have any questions, save your questions. We are going to have a Q&A at the end. You can either ask your question, you can use the chat box and type your question, or you can use the raise hand icon and your line will be unmuted. Next slide. These are the objectives for today's presentation. First, we are going to review some evidence-based practices to prevent teen pregnancy and HPV vaccine promotion. Then we're going to list some strategies to promote HPV vaccination among teens living in public housing. We are going to recognize other health issues impacting adolescents in public housing. And we are going to hear and learn from Catherine Patterson, who is the program manager at Altamed, and she works for the Women's Health Program. And next slide, please. So before we get started, we are going to hear from Catherine Patterson. She is a public health professional with over 15 years experience working to end health disparities in a variety of communities across the United States. In her current role as Women's Health Program Manager with Altamed Health Services, she provides operational leadership to community-based health education and outreach programs, including teen pregnancy prevention and clinical services at 25 clinic locations across Los Angeles and Orange counties in California. With us is also Fide Pineda Sandoval. She is the research assistant at the National Center for Health and Public Housing, and she provides analytical, technical, coordination, and logistical support to the National Center. Ms. Pineda has over 5 years of experience in providing direct clinical and administrative assistance to healthcare providers. Prior to joining the National Center for Health and Public Housing, Ms. Pineda worked for the Office of Student Scholarship, Creative Activities, and Research at George Mason University, where she collaborated on research on racial disparities in cancer treatments. Ms. Pineda is responsible for developing materials, publications such as infographics and fact sheets. She writing reports, analyzing data, planning and implementing dissemination rollouts in support of training and technical assistance activities. She has developed and delivered training content webinars for health centers and outreach workers. Ms. Pineda holds BS in Global and Community Health from George Mason University. And I'm going to stop for a moment. I would like to turn it over to Catherine. She is going to briefly talk to us about the teen pregnancy prevention program that they have in place at Altamed. So I'm turning it over to you, Catherine. Good morning.
Good morning. Good morning, everyone. Thank you so much for having me this morning and letting me share some of the great work that my team is doing out in the community in Los Angeles County and Orange County in California. Just to give folks a little bit of a background, again, my name is Catherine. I'm the Women's Health Program Manager at Altamed. Altamed has about 25 clinic locations, including 3 locations that are within public housing developments in LA County, across LA County and Orange County. And our primary population that we serve at Altamed is Hispanic and Latinx populations and other populations in LA and Orange County that have faced historically and currently a lack of access or disparities with regard to healthcare. So one of the things that Altamed is committed to doing in the community is to providing services around teen pregnancy prevention. And so on my team, we have several different grants that support the work that we do. We have about 20 team members altogether. We have 10 health educators and 4 peer educators that do our pregnancy prevention programs. And our most recent funding source, we were awarded a grant in, July of this past year to provide from the for OPA, the Office of Population Affairs, to provide teen pregnancy prevention. And basically with this program, we are replicating evidence-based programs in LA County. We identified areas within the county that see an increased number or rate of teen pregnancy in the different areas that we serve within Altamed, and really are focusing in on those areas with our efforts. We have our health educators who are out in primarily high schools, community-based organizations, anyone who really wants to partner with us around teen pregnancy prevention activities. Right now, obviously, we're facing a little bit of some challenges in that most of our schools in the area and a lot of community-based organizations are closed, during this time with COVID-19 concerns. But generally speaking, my team is out in high schools, really targeting that 15 to 19-year-old age range, as well as pregnant and parenting teens up to about 21 years of age. And it's really a combination of work out in the community and then linking those community members, those youth that we provide education to, back to our clinic locations. It's really kind of the critical thing that we do, and one thing that makes us quite successful in our work is that we have that connection for the youth. We see the education that we're doing to prevent teen pregnancies, to prevent the spread of STIs and HIV, as being very critical, and then really that linkage back to accessing that care at either one of our clinic sites or another community clinic in the area, so that you can really make that education that we're providing actionable. As a part of the curriculum that we're delivering a curriculum called Positive Prevention Plus. It's a 13-unit a course that usually we will provide in the high schools during a health education class, or as we work with the local school districts to understand what their needs are. And then we also partner, like I said, with other community organizations like the YMCA, with other social service organizations within the community to provide these services as well. And then as we link them back into the clinic, one of the unique pieces of our program is that we do have teen clinics. We have teen clinics located right now in 2 locations. We are looking to open up a couple of additional locations. But it's really a safe space where youth can come in, they can access services like birth control, STI testing. We're really lucky in California to have a great program at the state level called Family Pact, which enables our youth to access any kind of family planning services or services to prevent STIs or to treat STIs free of charge and confidentially. Even if they have another payer for healthcare, if they're concerned about, mom or dad or a guardian finding out about them accessing services, they're able to utilize the Family Pact program to still be able to come into the clinic and access birth control or other services that they may need. So the health educators really play that pivotal point of providing the education. Then we have our peer educators who kind of take on that linkage work that I was referencing. So the peer educators, we have a hotline that youth can use. It's a text-based hotline HIPAA compliant, so that the youth can text if they have a question or if they have a need for an appointment. If they heard, if they were out in the community and heard one of our health educators and they really want to make an appointment, the peer educators really walk them through that process of connecting them up to the clinical services. For a lot of youth, it's scary the first time they come in to the clinic. There's a lot of paperwork, especially if they're accessing care for the first time. At 15, 16 years old, it can be a little bit scary. So the peer educators really help them kind of navigate that system, help them make the appointment. If they want the peer educator to meet them at the clinic for that appointment, they will do that just so they get more comfortable with the clinic. And really with our teen clinics that we offer as sort of that drop-in clinic opportunity, it really helps remove a lot of the barriers that we see with young people accessing care. We know especially, our youth are not that great at following through with their appointments, high no-show rates, things like that within the clinic. So having that drop-in environment for them is really helpful, that they know, once a week or twice a week, depending on the clinic, they know that they have that space that's available to them to come in and access services. Let's see. So, again, it's really about the education that we are providing. We have about 10 health educators and peer educators. We're reaching about 2,500 youth within Los Angeles County annually. We are really committed to using social media to promote the service, to promote a more youth-friendly approach to care at Ultimed. It's one of the things that we have really focused on is, making, again, sort of that linkage between, what the youth are saying that they need when we're out in the community. One of the founding principles that we have for the work that we're doing is that youth are involved all the way along in creating the program and evaluating the program. With the funding that we have through OPA, we have been able to put together an advisory board of youth, and they really do help us sort of refine, the curriculum that we're using is great, but as we go, things change, especially the language. We want to make sure the curriculum is culturally appropriate. We want to make sure that it's trauma informed. And our youth that are on our advisory board really do help us ensure that the curriculum is meeting those needs for the communities that we're serving. So it's been a really great experience for us to have that connection with the youth. And the final component of the program that we're offering right now is actually a parent component. So as youth engage with our services, as they're going through the curriculum in schools, as they're coming into our health centers, we really want to make sure that they have trusted adults in their lives that they can go to, that they feel comfortable with talking about some of the topics that we're talking about through the curriculum. So we offer parent workshops. Anytime we go into a new facility, or every year when we go back to to our current partners, we always offer a parent workshop. And basically, the parent workshop is to, number one, inform the parents of what their kiddos are going to be learning in the classroom and through our program. And then number two, to help the parents really extend that conversation in the home. So we educate parents on how to talk to your child about sex. We educate the parents on the topics that we're teaching on, so they feel comfortable in understanding what their children are being taught, and that they have a shared language then to talk about some of those issues. We focus a lot on healthy relationships through the curriculum, and that's especially a critical piece that we focus on with our parents, is how to really talk to your children, to your youth, about the relationships that they're in, and how to identify what's a healthy relationship versus an unhealthy relationship. And so through that process, then we have sort of our second advisory group, which is the parents. We really want to make sure this curriculum is, in this program, is seen as something within the community that's going to be helpful to the community, that it's something that the community is asking for, that there's a need for. which really helps us then in turn build sustainability for the program. As we all know, grant funding is usually given in 1 or 2, maybe 3-year increments. We really want to make sure that these programs are able to sustain past any grant period we may have at a given year, and so building that trust within the community, building that that need for the service in the community really helps to just get that support that we need to ensure that the program continues and is sustainable for the community. So that's really it in a nutshell. Jose, anything that I missed that you were hoping I would touch on?
Maybe thinking about developing a teen pregnancy prevention. So can you go over the assessment that you did in the community and probably some of the challenges that you had when you went over
Sure.
all these evidence-based practices?
Sure. So we did a fairly broad assessment. We do continual assessment as we go, but before we really look at a new funding source or we look at expanding the program, we do a very thorough assessment with the community. We utilize our advisory groups for that purpose to see, number one, is there an ask or is there a need for this service in the community? I think a lot of times as healthcare providers or social service providers, we think we know what may be a good idea, but a lot of times, the communities may not be on the same page. So we utilize our advisory groups that we have, our patient advisory groups, as well as our youth advisory group, to really get we did surveys for the community at large, and then some group exercises with the youth to try to assess the need or the perceived need within the community for the service. We really worked very closely with our local school districts, or our Los Angeles Unified School District, as well as some of the surrounding school districts and the charter schools that we work with, and our community partners as well, to assess the need for the program and the acceptability of the program, especially when you're talking about teen pregnancy prevention activities. A lot of school districts have very set rules and regulations, and a lot of organizations have thoughts around what kind of activities that they are willing to participate in, or that they are looking for when it comes to teen pregnancy prevention. Some school districts, some organizations are even some county entities are very interested in comprehensive sex ed. They're looking for something that is really going to either meet. So in California, we have some state mandates around what sexual health and reproductive health education looks like. So we really worked with some of our partners. We did run into a couple of school districts who were not quite there in terms of their parent groups and their boards being very supportive of very comprehensive sexual health education. So we had a lot of conversations with our partners to see, what exactly they were looking for. And that really helped us choose a curriculum that we wanted to pursue with our evidence-based program. So that really helped us guide, that assessment really helped us guide and ultimately choose what we're doing now for this program, Positive Prevention Plus, because it seemed to be the best match for the needs that we were hearing out in the community. And then, really we were just looking for some funding that would really match to what we were attempting to do. And again, like I mentioned, really evaluating what are the areas that are at greatest need for these services. So looking at areas that have higher incidences or higher rates of teen pregnancy, of STIs, HIV, some of those sort of markers, so that we could really target to areas. And then we really did target to areas that were close to one of our clinic locations or close to where we had existing services in the community, so that we could really access those communities as a trusted member of the community easily and build those relationships, and then really make it ease of access then to clinical services for the education. So I think, especially for folks who don't have clinical services attached, or maybe or maybe not quite as large as Ultimed, with the clinic locations, finding those partnerships is very key in that assessment period of understanding where the resources are in the community and how easy it is to sort of connect the teen pregnancy prevention activities to those resources in the community that are really going to extend what happens in the classroom, or what happens through the implementation of the curriculum into sort of real world action.
Thank you, Catherine. And just one more question. Some of the members of the audience, again, probably are trying to see how they can incorporate CHWs or peer educators, as you mentioned, in an evidence-based program. What is your experience working with CHWs, and what's the role that they have?
Sure, yeah, so all of our peer educators are CHWs. We really chose, with our target audience of being, that older youth, or that 15 to 19-year-old youth, it was really important to us that we chose peer educators or CHWs that were very relatable to that population. We actually made it a point to try to choose folks who had been through a similar program before, either with us through one of our other grants, or through one of our other programs at Ultimed, and really chose folks who were really passionate about their communities and the health of their communities. It really takes somebody who is authentic and is able to really connect well with the community. I think in that role is very critical. Speaks the same language as the community. Identifies as somebody from within the community to really help folks take those necessary steps for their own health. So for our peer educators, that's really where we targeted. We have a couple who are full-time. We have a couple who are only part-time. But we try to really match up those folks that are really closely resemble our target audience. And with that, we provided a lot of training. This is, a lot of the topics that we cover through the education, and just in terms of the family planning services and teen pregnancy prevention, they can be sensitive topics for folks. And so we provide our peer educators with extensive training. We have an organization here in Los Angeles called Essential Access Health, who actually runs a family planning health worker curriculum that they offer multiple times throughout the year. So we sign up our peer educators for that program. And then we also train them on options for healthcare coverage, like insurance, and helping folks connect to real basic resources that they may need, including health insurance, so that when they're working with the teens, and then they're working with their families, they can really provide a comprehensive service to those folks.
Thank you, Catherine. And Catherine is going to stay with us in case you have any questions for her. So we are going to continue we need to cover the learning objectives, but we're going to get back to you, Catherine, at the end. Thank you. Next slide.
Thank you so much.
Next slide. All right. As you heard from Catherine, when you are trying to develop a teen pregnancy prevention, basically you have different audiences or different people working together. You can either work with the teens or the parents, and there is a link here with the providers, as she mentioned. The peer educators or CHWs work very closely with the providers and members of the community. Next slide. So in regards to communities, remember that health centers basically are community-based organizations, and how they can work with the other members of the community. So the very first thing is to, as we said during our last session last week, you need to assess the needs. You need to work with either the public housing agency or some of the members of the public housing leaders and discuss the need of an evidence-based pregnancy prevention program. Then you need to go and find a type of funding, either federal grant, or you can go and discuss with your state Department of Health or your local Department of Health and see whether they are offering any teen pregnancy prevention program and whether they are funding any of these teen pregnancy prevention programs. And then you need to develop a behavioral intervention, and this is really important, as Catherine mentioned. I mean, you need to have in place a trauma-informed care or refer to a behavioral health and work very closely with the behavioral group to make sure that you are addressing all the needs that the teens may have, and not only the sexual aspect, but the behavioral aspect. And then we need to develop training materials for this. You don't have to reinvent the wheel. You can work with your state health department again, or you can go to the Centers for Disease Control and Prevention site, and you will find training materials and resources, fact sheets, and all kind of resources that CHWs can use to develop the education that they need in the community. Next slide. And this is just an example. This is taken from the youth program at the Center for Disease Control and Prevention. This is a fact sheet, and basically depicts all the steps when a teen goes to a health center or another provider in the community to get information and services on reproductive health. So this is some of the materials. This is just an example of the material the CDC has on its website. Next slide. And then do I have to turn it over to you, Fide?
Yes.
All right.
Thank you so much, Dr. Dillon. So my name is Fide Pineda, and I am the research assistant here at NCHPH. And basically, I will be providing a few examples on some evidence-based practices. So the first example here that we see is the Teen Pregnancy Prevention Program, which is basically an overview to the program that Catherine was mentioning earlier. So basically, this is funded by the Office of Population Affairs, and it is a national evidence-based program. Give me one second. And it funds diverse organizations that work to prevent teen pregnancy across the United States. So the program targets adolescents ages 10 to 19 years old and focuses on providing services and reaching to vulnerable populations, including teens that are homeless, living in foster care, or that are involved in juvenile systems. So in regards to the grantees involved in this program, the OPA-TPP program funds 91 grant communities where each of the grantees fall in one of the categories provided below. So the first category, grantees basically have to be implementing evidence-based teen pregnancy prevention programs. They have to be building capacity of youth serving organizations, supporting technology services, evaluating new and innovative approaches, and developing and testing new and testing also the new strategies. So what has been the impact that the TPP program has done at a national level? So far they have served over 1 million young people across 40 states. The currently serves approximately 250,000 young people per year, and they have trained over 11,000 professionals. So it has been established in partnerships of more than 3,600 community-based organizations. And over here, we just have an example of where you can find findings from the TPP program and how different methodologies of implementation have been conducted. And you can find this through the American Journal of Public Health. So if you follow this link here, you will see that there's like a variety, and there's a list on all the different findings that have been reported from the TPP program. So this is another strategy, or sorry, an evidence-based practice, which is called the Making Proud Choices. This is an evidence-based curriculum type of program that increases the knowledge and skills necessary to reduce the risk of pregnancy, HIV infection, and STDs. This has been implemented in the Alameda County Public Health, where they have partnered with the Oakland Unified School District, Asian Health Services, and Girls Incorporated of Alameda County. This program is an interactive, youth-centered program where that basically focuses on holding discussions in small groups. And the program also is composed of games, interactive activities, role plays, handouts, and posters and videos that are made specifically for teenagers and that are made in a way that is appealing to them. So this is just an example of the curriculum topics that encompasses the Making Proud Choices program. So here we just see that through modules A all the way to module 8, there are different topics that are discussed, such as a puberty overview, getting to know you and steps to making your dreams come true. What are the consequences of having sex? And also HIV, that you can also get HIV infection. What are the attitudes and beliefs about HIV/AIDS and condom use? What are some strategies for preventing HIV infection? The consequences, negative consequences of sex that have to do with STDs and correct condom use, also unintended pregnancies, and developing condom use skills and negotiation skills. And they also go over role plays and refusal and negotiation skills. So this curriculum has been delivered during the school day for about 1 hour each session. And of the total population of the 2,653 teens that were reached with this program from 20 middle schools, 83% of students were reached with the program. So what are some of the key findings to this program? So one major key finding here is that it had a positive impact in the lives of the adolescents that were reached. Students showed an increase in understanding on how HIV is transmitted, understanding the methods against STDs, pregnancy prevention, and they also felt more comfortable talking to peers and their partners about reproductive health. Also, 88% of students felt that the program helped them make more responsible choices. And now I'm going to pass it to Dr. Leon. One second. Sorry, Dr. Leon, I can't hear you.
All right, can you hear me now?
Yes.
Great, thank you. Remember that when you have one of these evidence-based programs in place, this is a very opportunity to have a hybrid program like the one that Fide mentioned. Basically, it provides not only teen pregnancy prevention information, but also it's a really good opportunity to educate teens on different STDs and HIV/AIDS. So this is a very good opportunity to discuss different aspects that are related or linked to teen pregnancy. So in regards to the training it was mentioned before about the need to develop content and develop a curriculum. But remember that there are three important topics that, even though these are for clinicians and staff, the techniques apply to all those who are going to be working with the teens. Remember that you need to be culturally sensitive. Cultural competence, health literacy are important aspects when you are going to develop content, when you're going to develop a conversation with teens. As we mentioned before, you need to have a link with the behavioral counselors. You need to make sure that if there is any teen mentioning any kind of issue that is related to a behavioral condition or requires the intervention of a behavioral specialist, this is an excellent opportunity to link the patient to the clinic and specifically to the behavioral division or clinic. If by any reason you don't have one, then you need to work with other members of the community, so you have that particular aspect covered when you are promoting or when you are developing these programs. And this is a great opportunity as well to discuss about pre-exposure prophylaxis. Remember that HIV/AIDS is still in some communities, this is a rampant issue, and that's something that you can discuss, and refer teens who are at risk or who believe they are at risk of contracting or acquiring HIV. Next slide. In regards to trauma-informed care resources, remember that we mentioned the Centers for Disease Control, where you can find resources for teen pregnancy prevention. And this slide just shows some of the resources that you can also have in place in regards to trauma-informed care and fact sheets, and again, all kind of information for patients. The slides, we are going to share the slides. All the attendees will receive a copy of the slides. So if you are interested in learning more about these resources, you can click on the links, and then you will find information about all the resources developed by a federal organization as well as other members or nonprofit organizations. Next slide. So remember that there are a couple of things that you need to make sure when you develop the content. Sometimes you will be able to adapt some of the evidence-based programs that Fide mentioned, that those two are just examples, but we do have others that you can explore if you go to teens.gov. Once you are on teens.gov, there is a section on the left-hand side where you see the table of content, and you will find a list of all the evidence-based programs developed by HHS or some other organizations working with HHS. And this is really helpful because you can go over some of the content. You can go over the content. You can go over the learning objectives. And based on the needs in your community, based on the assessment, then you can say, okay, this is the best program that we can adapt and work or develop at other clinic. If you have, if you are working with other organizations in your community, if you're working with your state health department, then they can give you additional information on the type of programs that they have in place, or the funding that they have for some of the programs that are listed on youth.gov. So remember that in order to have a really honest conversation, an open conversation with teens, you need to avoid any religious judgment. You don't have to make assumptions or try to avoid terms and make assumptions about sexual behavior. Remember that you have to ensure shared understanding around terminology and pronunciation from patient concerns. You have to establish rapport and consent before addressing sensitive topics, and respect the patient's right to decline answering some of the questions that you may ask. You have to use a sensitive tone that normalizes the topic that you're discussing, and use neutral, uninclusive terms that avoid assumptions about orientation. As part of the training activities that we provide, yesterday we had a conversation about cultural competence and cultural humility. We discussed some of the aspects of sexual orientation and gender, and that is a very sensitive topic. So we cannot assume that because we are talking to a female teen or a male teen, that is the sexual orientation or the identity that they refer. So this is something that you need to also have in mind and take into consideration when having any conversation with the teens or the parents or the members of the community. Next slide. This is a slide from the American Family Physician website, and this is really important. Even though this is for clinicians, this also can be used by anybody who is providing some kind of teen pregnancy prevention or HPV prevention programs. Remember, and this is the 5 Ps model. One is, remember that you have to discuss first partners with the teens, how the partners identify them. There are some difficult questions or very sensitive questions to ask, and even though probably this is not what the role of the CHW, they need to keep in mind that these are some of the sensitive aspects of conversation with a teen. Then the other section is practices, and you can have, depending on the type of sessions that you are going to have. In our last session, we discussed different type of sessions that you can develop in the community. And these are some of the topics that you can discuss in addition to the 3rd P, which is past history and protection from STDs and STIs. Next slide. And then there is the part where you discuss the pregnancy plans and pleasure. So these are very sensitive topics that this has to be discussed with the teens once you have the right environment or the right opportunity to discuss these kind of topics. And as Catherine mentioned, so sometimes the peer educators need to be about the same age, so they have that trust, and by developing that trust, then you can refer patients to the clinic where they can get additional information from the clinicians. Next slide. This is an example of gender inclusive terminology. Remember that there are several ways, several new terms that you need to be at least familiar with. As again, we've had a conversation yesterday from a member of the transgender community, and she was explaining all these different terms and how important these terms are when you are discussing sex with teens or any other group. Specifically when you are also addressing the LGBTQ community. And remember that we mentioned that when you develop a teen pregnancy prevention program, you also have the opportunity to discuss STDs and HIV prevention with the teens. Next slide. Next slide. Then we are just going to briefly talk about HPV, since that's the other aspect that we were mentioning and regarding how you can also develop an HPV vaccine promotion program in the community. And just as an introduction, remember that HPV is the most common sexually transmitted disease in the United States and probably all over the world. There are different types of viruses. The most frequent are the HPV-16, the HPV-19. Both are in the quadrivalent vaccine and the bivalent vaccine. And these are cause of genital warts and cancers. So in addition to discuss cervical cancer prevention and the use of the HPV vaccine, you have the opportunity to discuss not only HPV infection as one as an STD, but the opportunity to discuss STDs or STIs with the teens in general. Next slide. Now, does HPV cause cancer? And the answer is yes, it does. I mean, it's the main cause of cancer, or probably the only cause of cancer, cervical cancer. But remember that cervical cancer is not the only type of cancer caused by HPV infection. There are HPV infection has been linked to oral cancer, to throat cancer, to cancer and the penis, and another type of cancer, including, as I mentioned, throat and anal cancer and oral cancer. Next slide. So these are the type of cancers, as I just mentioned. You have the penile cancer, vaginal and vulvar cancer, anal cancer, oropharyngeal cancer, and some pre-cancer lesions. On the top, you have the cervical cancer, which is the most frequent. Next slide. So remember that everybody links HPV infection to cervical cancer, but as you saw on the previous slide and this slide, this is just the tip of the iceberg, that there are other types of cancer linked to HPV infection, and there is the need to develop a prevention program and discuss this HPV infection and other STIs with the teens. Next slide. Also remember that there are some pre-cancers and some lesions that probably are not going to develop to cervical cancer, but they can be the cause of some other complications, and patients even can have issues when they are trying to get pregnant. Next slide. And again, this is slide has just statistics on the other HPV cancers or other cancers associated to HPV infection. Again, the most frequent is the cervical cancer, but we have again anal, oral, oropharyngeal cancer, and penile cancer associated to the HPV infection. Next slide. So why is this so important? Because remember that we said that once you do once you talk to the community, once you assess the need, all the the three topics are closely related: teen pregnancy, STIs, and HIV/AIDS. So this is a great opportunity to discuss the three topics with teens, and at the same time, you can refer the teens to the clinic if they have not received any of the HPV vaccines, either the quadrivalent vaccine or the bivalent vaccine, that they can get and somehow prevent HPV and and at the same time discuss other types of prevention. And remember the ABC message, that is the A for abstinence, B stands for be in a monogamous relationship, and C, the use of condoms to prevent any of these diseases. Next slide. And you can also discuss with teens the benefits of the HPV vaccine. Remember that this is an inactive or inactivated vaccine. It means that it doesn't have live viruses, that protects against the most frequent HPV, cervical cancer, HPV, like the 16 or 18 that are the most frequent, or the most, or the ones that are associated to cervical cancer. And they are recommended for young females and males, 11 to 66 years old, and it has only a few side effects. Most of them are localized. And this is, again, a great opportunity to discuss the benefits of the HPV vaccination. Next slide. And this is a slide just showing how long the vaccine protection lasts. Basically, once a patient receives the recommended doses, there is no need to give a booster dose. The vaccine has a long-lasting immunity, and the patient doesn't need any other dose. Remember that the vaccine is covered by the Vaccine for Children program if the patient is underinsured or has no insurance. Next slide. And these are some steps. Is that your slide, Fide? Okay, sorry. Now I'm turning it over to Fide.
All right, thank you so much, Dr. Leon. That was very good information that you provided on HPV. So now here we just have some examples of some evidence-based practices related to HPV prevention. So here we have, this is basically some information obtained from an action guide from the American Cancer Society to implement evidence-based practices. And basically, the benefits of implementation of this program, give me one second, sorry, is that it increases vaccination rate. It also helps parents be more motivated to get their children vaccinated. And it helps in integration of cancer prevention into existing systems of care. So one of the biggest predictor of HPV vaccine uptake is the effective recommendations from a healthcare provider also serves as a great addition for quality improvement efforts. And then here at the bottom, we just have the source where you can have access to the steps for increasing HPV vaccination in practice. So this is basically an overview of what are some of the recommended steps to take. So the step 1 is to assemble a team. Step 2 is to make a plan. Step 3 is to engage and prepare all staff. Step 4 is to get patients vaccinated by their 13th birthday. So some of the things to note here is that if your clinic is not able to tackle every step, or your organization, steps 1 through 3 can help build capacity to implement the evidence-based strategies. And in step 4, consider starting with 1 or 2 strategies that are most realistic for your clinic or organization. So vaccination programs, home visits to increase vaccination rates. So this is another type of evidence-based practice that has to do with the use of home visits. This is a practice recommended by the Community Preventive Services Task Force. And one of the things to note here is about what do home visitors do. They assess clients' vaccination status. They discuss the importance of recommended vaccinations, and they provide vaccinations to clients in their homes or refer them to other services. And who are the visitors that do the home visits? The nurses, they usually provide vaccinations. social workers, and also community health workers. So vaccination programs, in regards to their target population for this program, is that it may be directed to everyone in a designated population. It also targets low-income single mothers and others who have not responded to previous intervention efforts. So maybe you have tried to implement a program in the past, and then maybe you have kept track of those who didn't complete that intervention. This is something useful that you could do to basically kind of do a follow-up and see if they would respond to this one. So forms of implementation is maybe implemented alone or as part of a larger healthcare system, maybe part of a community-based program to increase vaccination rates. In-home visits are potentially effective in addressing a wide range of public health problems. So in this case, HPV vaccination promotion and teen pregnancy prevention. So then lastly, we have the Amigas program, which this is called Ayudando a las Mujeres con Información, Guía y Amor para su Salud. And in Spanish, this translates to helping women with information, guidance, and love for their health. So this is a bilingual educational outreach intervention program that was designed to help promotoras or community health workers increase cervical cancer screenings. It also works with women who are experienced community health workers or promotoras in their communities to deliver education, and stresses how information and skills learned in the intervention will help women, their families, and their communities stay healthy. It provides culturally appropriate bilingual information. It uses naturally occurring social networks to recruit women. So examples of these natural occurring social networks could be such as community-based facilities, you know, it could be through churches, it could be through like the local YMCA, and so on. So we, in the past, have developed also another learning collaborative on cervical cancer prevention that you can access on our website at nchph.org, and you can basically take a look at all of the tools and the implementation methods that are needed to implement this program. So now we're going to talk about.
Let's stop here for a moment, and probably we'll have to use the last 5 minutes for the Q&A. Let's see whether we have any questions, and we will continue next week with the health issues impacting adolescents in public housing. So at this moment, I would like to see whether we have any questions either for Catherine, for you, or for myself.
Yes. So we have a few questions. Just give me 1 second while I pull them up. Okay. So one question is, somebody would like to know how was Catherine, this is for you, Catherine, how were you able to establish your youth advisory group?
Sure. Can you hear me?
Yep.
Sure.
All right. So that was something that was really important to us, as I mentioned. So we did a couple of different sort of recruitment outreach activities to try to get participants. We did focus on folks who had been through our program or similar youth programs in the past. So that was a big recruitment strategy for us, was to look at youth who had gone through similar programs or other programs at Altamed who expressed some interest in participating in the advisory council. We did incentivize participation. That was also a pretty important thing for us to be able to do. We wrote it into the grant funding. A lot of ways to get youth to participate is, simple things like pizza or movie tickets. We bought some movie tickets that youth could access if they came to some of the meetings that we had for the group. We partnered with a couple of community organizations who serve youth in the community and had some tabling events or participated in health fairs or different community events that they were having to basically, we had some brochures, we had some signs that said, you know, we were looking for youth to provide their voice into healthcare, and really kind of focused on those populations where students were already active. One of the other avenues that we took advantage of is a lot of students in the schools in our area have to do some sort of community service as a part of their classes or as a part of the programs that they're in, either in their in high school or in maybe community college. So we also reached out to those folks, to the teachers and to the directors of those programs, and offered this as an opportunity where students could complete their requirements for community service. So we really did try as much as we could to, you know, to meet the needs of the youth, in addition to our needs, you know, that we had for the program. Like I said, through incentives, through our existing partnerships, and through different groups where students were already likely to be engaged in working or advocating within their communities.
Thank you, Catherine. That was very helpful. Thank you so much. Do we have any other questions in the queue?
Yes, we have one question. This is basically in regards to, you know, the current pandemic on COVID-19. So basically the question is, given the current COVID-19 crisis and the closings of schools, leaving kids with much time and with in-person contact being so risky, are you building any of COVID-19 into any of your materials so teens understand the added risks of this disease, and adds to social media and sexual contact? Are you able to reach your audience through your website or social media?
Is that for us?
That question's for me.
Yeah,
I can take a stab at that. I can at least talk about what we're doing. So we are looking at a couple of different options through our social media outlets. We are posting information about COVID-19. We know that, you know, youth feel a little bit like they're invincible at times, so we, you know, try to really encourage social distancing, and, you know, really taking this time to stay away from crowded areas. So we really do use that outlet to provide information, and we are also looking at virtual options for providing health education and for providing some of the interventions that we offer. We're exploring that right now with OPA, with Office of Population Affairs, as well as kind of our internal tech folks, to see if we can offer that the curriculum, or at least, you know, some version of it virtually through WebExes like this, or through other means, so that we can continue to deliver the information during this time.
Excellent. Thank you, Catherine. Thank you so much. That was a great answer. Any additional questions?
Do we have time for one more?
Yeah, we have time for just one more question.
Are there any safe spaces for LGBTQIA teens to learn sex education? And I believe this would be for Catherine.
Can you repeat the question for me?
Are there any safe spaces for LGBTQIA teens to learn sex education?
That's a really great question. That is one thing. So one of the things when we picked a curriculum that we wanted to use, or we picked, you know, an intervention that we wanted to replicate, is we looked very, very carefully at the language that was used, at the videos, at the examples, you know, that were used to display relationships. We did really look, you know, with a fine-tooth comb, and we made some adaptations as we are going to the curriculum itself, to make sure that it is inclusive, that it is gender non-specific, that it really does, you know, reach a very broad audience. And for us, for especially the teen clinic activities that we offer, one of the things that we do in conjunction with that is to reach out to some of our organizations. We have a large HIV services department at Ultimed that we partner with to make sure that youth that are out there that identify as LGBTQAI are really know that we're a safe place to go. We promote that with our social media, and we really do try to make that teen center or that teen clinic very safe place for anybody who comes through the doors. And we've identified clinicians, we've identified providers who are really good at really serving that population well and serving youth well. So we only make referrals within our organization and then with outside to providers that we know who are going to be non-judgmental, that are going to that have been trained either by us or others, to use the right language, the right words, the right terminology. So we definitely pay very close attention to that. And like I said, a lot through our messaging and through the use of the curriculum as well.
Thank you, Catherine. I believe that we are over time. So if there are any other questions, we are going to make sure that we are going to respond to your question via emails. If your questions are directed to Catherine, then we are going to make sure that she gets the questions and you're going to get the response via email. Thank you for being with us today. It's been such a great pleasure. And thank you, Catherine, for all your support and expertise. To the attendees, please do not forget to complete the post survey. And remember that our next session is next Tuesday at 1 p.m. Eastern Time, 10 a.m. Pacific Time. So thank you so much for being with us, and I hope to see you next week. Stay well, stay healthy, and thank you for everything that you're doing to address COVID-19 in your community. Thank you and have a great afternoon.